Good evening and good afternoon wherever you're watching us from. I am Dr. Morales and I'm going to talk to you today about a topic that interests me, which is COVID-19 vaccine and Lyme disease. I hope you all enjoy this capsule. It is going to be filled with useful information regarding the COVID-19 vaccine and some information regarding how it could do or cause autoimmunity in certain Lyme disease cases. I will say and state that I put together this information which will expose nothing more than the research I have reviewed about COVID-19 vaccination and how this could affect some Lyme disease patients. This is my opinion and should be taken as such, as I do not intend to discourage or promote vaccination, but will in fact try to clarify concerns regarding the vaccine and regarding the illness itself. My goal is to provide our Lyme patients with concise, digested information about this topic. As a Lyme doctor, as a former Lyme patient myself, and as a Lyme advocate for Lyme research, I decided to chime in with my opinion on the matter, as I did back in July when we were discussing the Lyme vaccine, which still is in process. I think it's not going to happen anymore, by the way. I believe in the process in general of vaccination for the general population, and I believe in the prevention of diseases from vaccines and the prevention of COVID-19 as well. However, due to its novelty, to its speedy manufacturing, and the concerns that have arisen from this quick vaccine development, I, as well as several colleagues of the Lyme community, have questioned and have now been placed in the need of unbiasedly analyzing the possible side effects of this vaccine in our for our patients and for our community of Lyme patients. I think that in theory, the mRNA vaccines in general, not only COVID-19, but in general, I think they present a promising alternative to conventional vaccines because of their high potency, their capacity for rapid production, and for their low cost. However, we have started with massive application, millions of doses of this mRNA vaccine, untested before at this scale. So it's reasonable as for us to question and to ask ourselves, will it be safe for all? Will this be safe years to come after its application? Will it not cause autoimmunity and not thought of future scenarios? And could it harm our poorly studied number of patients? I'm talking about Lyme patients. They're already not understood completely. So would this be an added factor for discouragement if that be the case? I'll try to give you my opinion, and you guys are gonna have to decide that for yourselves. But I'll explain how ordinarily a viral immunity works. Is the virus enters the human body. In the human body, it goes into the cell, and in the cell, it provides the cell with the blueprints of information of what that cell has to do. This is the normal virus, the cough virus, the flu virus. So then that cell with that information has that information, and it starts multiplying that multiple number of times. So that's how the virus dissipates very quick. And not so quick is the immune system, because the immune system takes a little bit of time to adapt to these conditions, and that is why we call the adaptive immune system the important part that suppresses finally the virus. So in a normal circumstance, our immune system is really remarkable on how it acts, and it creates this immune response. But in a condition such as COVID-19, It's better if we give it a helping hand by developing vaccines, because we are able to provide, in a sense, a mugshot of the perpetrator before the attack even begins. So this provides the immune system with all the information and instructions required to find and attack the virus, in this case SARS-CoV-2 or coronavirus 19. And that is in a general sense how the COVID-19 mRNA vaccine is supposed to work. If we discuss the other approach, which would be conventional vaccines, and why didn't we use them for this? Well, the answer is simple. To produce a conventional vaccine, it takes roughly like 8 years of research and development. So this is not possible with the current death rate that we're seeing with COVID-19. We need a quicker approach. Conventional vaccines, they are made out of mild or weakened virus and parts of virus. And because they are made in such a way, this could get you sick from the virus or cause the same symptoms. We have seen this happen in the past when you get the flu shot. And that is why it's impossible for the current mRNA COVID-19 vaccine to cause this. You can't get infected of the COVID-19 virus or the SARS-CoV-2 in the vaccination process, because it doesn't have parts of living virus in it. It has instructions for your cells to produce with blueprints manufactured in the lab and produce a specific spike protein of the coronavirus that your immune system will then look and destroy. But I'm getting a little ahead of myself. With the traditional vaccination, it's easy to get contaminated. All of those batches of hundreds of thousands of viral vaccine process that takes place, it's easy to get it infected, or for those badges to die or get contaminated. It's also unsafe for humans, because at the end of the day we have our best scientists working around them, and they are the first ones that could get sick, and we sometimes forget about this. So the new mRNA technology reduces those risks. In a sense, it is a medical breakthrough, and it's isolated in the lab, and the effects should produce the right benefit that we're looking for, which is protection. Now, in order for me to tell you how the mRNA vaccine works for COVID-19, I would have to first tell you how mRNA works in general. And let's say for a second that this white piece of paper is a human cell. And in this human cell, we have ordinarily several machineries: the mitochondria, ribosomes, and we have in the middle the nucleus, the most important of them all. So let's say that this circle here represents the nucleus. In the nucleus, we have our genome, and our genome carries our chromosomes, 23 pairs to be precise. In some cases a little more, a little less. In these chromosomes, we have, each chromosome contains genes that have instructions on how to make each of the proteins that we require on a daily basis. So what happens inside, if let's say we go inside the nuclei and we're able to see what is inside, we have these strains of DNA. And in these strains of DNA, there is a machine called a RNA polymerase. This RNA polymerase is a copying machine. And what it's going to do, it is going to unplug, in a sense, the DNA, and it's going to allow some of these bases of the DNA to roam free, so that the machine, the RNA polymerase, can copy this and produce two identical copies out of one strain and then leave the original strain in the same nuclei where it was found and take this copy out of the nucleus and into the cytoplasm of the cell. In the cytoplasm of the cell, as I said, there are other machines, like I'm talking about cellular machines, not really electronic ones, like the ribosome, which is a machine that produces and synthesizes proteins. So in this ribosome machine, we have a entry of a code of three steps. Step 1, the ribosome attaches to the A site, and then step 2, the P site, and then step 3, the E site. So every time this is being copied and translated in the already available copy of the, or I should say the mRNA or messenger RNA that came from the DNA from a transcription process, this piece is going to then give an opening to the ribosome to create a special protein by using the building blocks, which are amino acids. So the ribosome with the mRNA that comes from the nuclei of the cell, which inside has the chromosomes, this at the end, this machinery of the ribosome produces a specific protein. In this case, with mRNA vaccine COVID-19, the protein that is producing inside of the cell is the spike proteins that are regularly found in the surface of the SARS-CoV-2 virus. And because it produces these spikes, now we're skipping the step where we are using the own cell's nuclei, and this, you can say, can cause a number of or develop a number of antibodies against other proteins, and that's some of the mimicking that could occur, because this is still new technology and we haven't really understood all of it. But what happens is that this process, by externally putting in our own recipe into the virus, into the cell, providing the cell with instructions that are called ADE, or antibody dependent enhancement. These instructions of ADE are going to have or make the cell produce these spikes in an artificial form. So we're hijacking, in a sense, the ribosome of the human cell, and this could possibly alter in the future some of its synthesis, and that is some of the possible side effects that we may see in the future or may not see, because we don't have enough information yet. But once that these little spike proteins of the coronavirus are produced, then we're, as I said, producing a mugshot of the perpetrator before the event ever happens. By that, we have an immune system ready to attack. But it is also kind of having an on button without having an off button. And this could pose a problem when it comes to the cellular signal and the autoimmunity in cases that are already predisposed to have autoimmunity. And if we talk about specific vaccines, Moderna, in their website, they say that it breaks down. This mRNA eventually breaks down, but they don't specify when and they don't specify how. So I don't even think they know, because obviously nobody knows. And that's something that we're agreeing, all of us, by getting vaccinated when we do eventually, some of us. that we're going to be subject to a sort of an experiment because this hasn't been done before. So mRNA vaccination versus conventional vaccination, obviously mRNA produces more benefits and it overweighs the risks for the majority of people. But we have to keep in mind that the minorities, the ones that have autoimmune expression, underlying illness that produces autoimmunity, they are more prone to getting side effects of these type of vaccines. And even though the mRNA vaccine is a promise for the future, may even may even make traditional vaccines obsolete in 20 years. No animals are involved, no risk of getting infected while you're manipulating as a scientist, and also could pose a great opportunity for cancer patients, some of which have mortality rates of over 80%, and they have no other option. These vaccines, these mRNA vaccines, could pose a fantastic application for that. However, by rushing the production, by skipping clinical trials, by skipping animal trials, by jumping into phase 3 clinical trials without the proper epidemiological surveillance, we could in fact be on the way to some sort of catastrophic situation in certain cases. So, as I said, the benefits definitely overweigh the risks, but it should still be discussed and assessed individually. That's what I'm suggesting, and what I'm asking. So I studied some of the articles. Obviously, they're very new because COVID did start very recently. I mean, the COVID-19 strain. And I liked one that discusses how the informed consent should be disclosed on every candidate that is receiving the vaccine, because they should know about the antibody-dependent enhancements risks, and the scientific community should be able to disclose all the research and all the information to the rest of the medical and scientific population, so that we can also assess with our own sense what are we taking and what are we doing when we're injecting ourselves with these vaccines. So there is sufficient literature out there that discusses the specific risks of developing that you have when you are getting the COVID-19 vaccine. But are we really doing enough in having the population understand what those risks are individually? I guess, and I think not. And this study that I'm talking about, this is designed in a way that it gives us information, and the information is that these patients that get the vaccine may get sensitized to recipients to more disease than if they were not vaccinated. So in some cases, some patients will get worse, but we have to determine which patients are those. And that's why it's important to offer the informed consent very clearly to the people that are getting the vaccine. In another study, reaction of human monoclonal antibodies to SARS-CoV-2 proteins with human tissues, it was able to clarify and explain how SARS-CoV-2 antibodies had reaction of 28 out of 55 different human tissues: gastrointestinal tissues, thyroid, neural tissues, including barrier proteins, and other tissues. So there is extensive immune cross-reactivity between SARS-CoV-2 and antibodies and different antigens of the human origin, and it may play a role in the multi-system disease process of COVID-19, precipitate onset of autoimmunity, and precipitate inflammation or exacerbate autoimmunity in patients who have a pre-existing autoimmune disease. So how does that tie into Lyme? Well, Lyme, not by definition, but by clinical observation, is a precursor to autoimmunity. And we have seen this all the time. There's no question of the inflammatory markers of the inflammation that a Lyme patient possesses. And this article that I read, Lyme borreliosis from infection to autoimmunity, shows us how there is a role between infection and autoimmune mimicry. Basically, we see how long-term infection in spirochetes in particular will induce chronic autoimmune disease in a number of cases, in a big percentage of them. We also see how this pathogen, this bacteria, can produce immunomodulatory response, either causing immune suppression or autoimmunity. And we also see that chronic disease in general, in talking about Lyme disease, will in some cases require immune suppressive treatment, even though they're not diagnosed as autoimmune. So everything shows that Lyme disease in a chronic stage could in fact possess a big autoimmune factor. There were even talks, as I said back in July, about safely applying a vaccine. But you know why they couldn't apply it to humans? Because they saw that the vaccination would in fact produce more autoimmunity in certain groups, in certain Lyme groups. And that's what we have to focus on. The fact that there are specific groups that are vulnerable to this type of immunological activation, even though those vaccines were not mRNA. Finally, another study, immunologic mechanisms in Lyme nodoborreliosis. We were able to identify different immunogenetic types which would predispose to different immunologic responses with distinct clinical outcomes. And what I'm trying to say here is that we know there are several subspecies of spirochetes. There's not just 2 or 3 or 5 types of Borrelias. There are hundreds of subtypes of Borrelias. And because of this, some are more predisposed to cause neurological problems, or some are more predisposed to cause joint inflammation, or some are more predisposed to cause autoimmune problems. And because we don't have the information of which cause which, we always have to take that factor into consideration. Now, what is the possible mRNA conflict here? Well, as I said, this ribosome, which is the protein synthesis machine in the cell, is basically getting hijacked by our technology, our in mRNA, that we have been able to develop in the labs by impressive scientists and dedicated researchers. However, that they've done this breakthrough in medicine, we're seeing that it's still lacking the epidemiological surveillance, because we don't have any information on how these are gonna shut off and how these are gonna change or not theoretically involve themselves with other fragments of proteins. Or how is the mRNA not going to be in the aftermath inappropriately binded to a different protein structure and affect the protein synthesis of something else? Or how are we going to be sure that it'll not compromise cell signaling, or it will not cause potentially attachment to other areas that could be then a factor for inflammation to attack that area? What if it attaches to the spleen? What if it attaches to the liver? What if it attaches to a kidney? And then we have inflammation being promoted in that tissue, in that kidney. So that's the questions that I'm posing here, which unfortunately I don't have the answers, and that's why I'm doing the research to see if we can get together to some sort of conclusion with this. But in general, the mRNA vaccination is, as I mentioned, a breakthrough. It is something to look at, something positive, but for certain groups, we need to be careful because we haven't tested these vaccines before with humans, and because we're not machines. We are very individually different from each other, even if we look alike. So we have to be very careful, and we're bypassing the natural immune response. And the body, when it gets exposed to disease, it could mount an exaggerated immune response, and all of these questions are still floating, and we don't know the answer. What we do know is that you get one shot of the vaccine, and you have a cytokine inflammation, the cytokine storm, and an immune response which is healthy, and people, their arms hurt, they have a little flu. That's normal. And you get a second shot, and we're already seeing that the reaction is much exaggerated, much more exaggerated in the second shot, but it's still considered normal. We should expect that. But what happens when we have a patient with a predisposition to autoimmunity, or an underlying illness, or a poorly understood condition with Lyme, and also a chronic autoimmune condition together? Then you give that person the vaccine, and you are going to stimulate cytokine storms, you're going to stimulate autoimmunity and inflammatory markers to be dispersed along that track and surrounding those tissues, if it's the kidney, the liver, the heart, wherever they are. Because we still don't have those studies completed. We're working on them, but we're working on them as we're injecting the vaccine to them as well. And I guess it's a question of, can you trust the manufacturers? Because at the end of the day, they are the ones who could, the information is published out there that they have done certain things in the past that are not necessarily the most compatible with our best interest. If, for instance, there was a vaccine in 2014 for tetanus in Kenya, you can look it up as that, and the manufacturer decided to put a birth control anti-pregnancy hormones information, and it was approved and distributed by the World Health Organization, and it caused massive abortions and birth deformities. And that is when you have to say, can you trust the manufacturer? I guess we have to decide for ourselves. But these kind of things, there is a precedent. There has been erroneous use, unethical use, if you may, and there hasn't been the necessary informed consents that that I would like to have for these people, the ones that don't know if they have a problem or not. So, in my opinion, I believe that the correct thing to do is to vaccinate as quickly and as many of the general population, the healthy general population, the ones that are not known to have autoimmune risks, vaccinate the most of them as soon as possible to help produce the necessary theoretical immunity or herd immunity that we're looking for. Because theoretically, if you vaccinate 60 or 70% of the population, then you are able to pass along that immunity to the rest of the vulnerable population. So I don't think it's too selfish to say, let's get the healthy vaccinated as quickly as possible so the not so healthy ones can stay at the end, and maybe some more information will be developed that could lead to determine if they in fact can be or should not be vaccinated. That's, I think, the argument. And my final opinion on this is, I think that if you have a history of autoimmune conditions, if you have a history of Lyme disease that is producing autoimmunity, I would extreme caution when vaccinating, and I would maybe think twice if that is your case. But if you have Lyme disease and you're in remission, and you have you had a good response to treatment, your Lyme illness did not go with a lot of or many or any autoimmunity, then you could safely get vaccinated for the SARS-CoV-2 virus. That is my opinion, and I think that a lot of the doctors in my field, I think they feel the same way, because we do want to get over this pandemic and we want to do it safely, but we want to make sure that we have information for our community, our Lyme community. That's very important. So I guess as a closing remark, I hope that you appreciate this honest, independent analysis. I've done my best to show you the promise of this technology, as well as some of the risks. And I know some of you may have asked, how are we working with this situation? Well, as restrictions have affected the way most of us operate in general, we are now including COVID-19 testing on all of our new patients on arrival and also on departure. So we're making sure they are healthy when they get here and when they leave. And if they're not, then we've also had to implement the ones that come some sort of immune enhancing protocols before they come to make sure that they stay healthy. And also there is some ways of inhibiting the virus from entering the body. But I think that it's important to mention that even though you can do vitamin C, vitamin D, zinc, turmeric, curcumin, which are all fantastic to start on to boost a healthy immune system, there is some evidence that is it's still in research phase, but there was an article recently on Newsweek about silver nasal spray being used. I have put many of my patients on this silver nasal spray. It is developed by the university who is my alma mater in research technology, and they appear in the magazine. And we have seen that you spray this and it actually could prevent COVID-19. So if you want information about that, I guess you can Google Newsweek silver nasal Mexico, something like that. Maybe you can find it. If not, we can provide the information. But another way that I have seen that they can prevent COVID-19 transmission is also by using oral ivermectin. I know it's very disputed. I know there's controversy around it as much as anything else, but the use of oral ivermectin 3 times a week has been noticed and has been observed to prevent the infection as well. So if you have to go and get some groceries, if you have to go to the bank, or if you have to go do a visit to the hospital because you have a problem in your knees, or because you just have something that you have to take care of, diabetes, hypertension, do it. Don't postpone it, because those diseases kill as well. But take some ivermectin or just put some nasal spray, hopefully medical grade, and with that inhibit the virus from ever entering. And that is all. I hope you enjoyed this information, and please take care, and we will keep in touch. I will make a video soon about other types of virus that affects our Lyme disease patients. Thank you very much.